Good afternoon. Welcome back to Midwife Par Excellence. This is your registered midwife, Bernard. I have missed you so much, and I want to send a big thank you and shout out to all those persons who would have found me on social media, made your requests, made your comments, shared my post. I really appreciate it, and thank you for the continued support for my subscribers. Remember that you find me on a midwife par excellence on YouTube. You look for the subscribe button and you also click that notification bell so you know when my posts are on. I want to thank you so much wholeheartedly. My Facebook fans, my YouTube fans, my Instagram family, and my WhatsApp family. I thank you guys. Alright, so I've been out for a few weeks, but I am here. And today I will be talking about a very popular topic that affects all of us. And we're talking no other, we're not talking about any other than child health assessment. Alright, so assessment of our children needs to be done in a careful manner, right? So that we do not miss anything. And parents, I want to implore you, ensure that your children attend the child health clinic, because that is the way how you're going to be able to find out or share your experiences at home with the children with your healthcare provider, whether it be your midwife, your doctor, or your pediatrician, and then proper assessment would be had if it is found that you are having a certain issue with your child, and then um, intervention can be had. But if you stay home with the children, no intervention takes place. Sometimes when the intervention comes, it is a little bit too late. All right, so I implore you to reach out to your healthcare providers, speak to somebody. All right, also another tip, please do not judge your children. All right, so if you are friends and both of you have, let's say, a 1 year old, do not judge how the child is developing, based on the other child. Remember that each child develops differently, right? So one child will put out some teeth before the other one. While at age 1 he might not have any teeth, but he's walking before the one that has teeth. He's not walking as yet, he's not talking as yet. So children do different things at different ages. Do not compare children. All right. um Child health records. So when the child comes to the child health clinic, the midwife or the pediatrician, these are some of the basic assessments that are done for your children in order to ascertain if all is well or intervention needs to be had. All right, now when you come to the clinic and the child is assessed, please, under no circumstance should anybody judge their child. No healthcare staff will be judging your child. The assessment that we do is based on a general assessment of all children, so should be judged. And parents, please, whenever you go to the health facility and an assessment is done of your child, just know that your child is not being assessed based on another child. Is just being assessed based on the general assessment tools that we have working with, because there are some little traits that you can know that all 18-month-olds will more than likely be having those traits, and those are some of the things that we use to do the assessment. It's not judging your child and saying, okay, at 1 year old he's not walking, so he is behind schedule. No, that is not what we're saying. We're just saying that at 1 year old, majority of babies at 1 year old, these are some of the things that they would be doing or possibly will be doing very soon. All right, so if when you come to clinic and your child is not yet doing some of the things that we ask if they are doing, it doesn't mean that your child is behind or the child is developing any less. It just means, it's just letting you know, these are some of the things that your child would be doing now or will be doing soon. All right, so even sometimes we tell you some of the assessment were things that you never even thought that the child would be doing. And sometimes when you look, the child is actually doing it as soon as you go home and you try to see if the child will do that. It's just that you never pinpointed it to say, okay, it was important, but it is important to us and the child's development. All right, so I will be going through the different milestones And so you can have a brief idea. And parents, as I said before, this is not judging your child. This is just telling you the basic traits between children of such ages. All right. So for example, our 6-week-old babies, when you put them on their tummies, they're going to be holding up their heads. All right. So we'll ask you if the child is doing that. And we, at 6 weeks old, we actually, every child, when they go to clinic, should be assessed. All right. Every child. So the nurse will take your baby from you, do a necessary head to toe assessment, and do notifications as such. So at 6 weeks old, is the baby, when lying on the tummy, holding the head up, right? When you have something in front of them, are they following the object around the room, right? And these are what the 6-week-old babies will more than likely be doing. When there's a rattling, so you have your little shake thing. When you shake it, is the child looking to see where the noise is coming from? Is the baby giving you a smile? Right? Is the baby giving you a smile? And you know that at 6 weeks, baby gets his first pentavalent, that's the 5-in-1 vaccine, and the inactivated polio vaccine. All right? At 3 months, we said that the child's lifting their chest, they lift their heads and chest up when on the tummy. So they are now having a better, they can now manage the head and coordinate the neck. All right. So when they're on their tummy, are they looking up and looking around and the chest? So it's no longer at 6 weeks where it's just the head coming up. At 3 months, the chest is coming up too. So they are practically trying to prop themselves up. All right. Hands grasping each other. So is the child able, are you seeing the child trying to grip at stuff, holding on to things? Is the child looking around? Is the child alert? These are some of the things we're looking for at 3 months. Is the child making a big laugh? I know some of these babies have some really loud laughs. Is your child laughing out at 3 months old? Right? And is the child smiling with you? At 6 weeks, at 6 months, is the baby sitting up? All right. When you put the child to stand on the feet with support, is the child standing strong on the feet? Is the child reaching out? So if you should put any object in front of the child, is the child reaching out to grab that object? And that's the way how we check for visual. All right. So we know if the child is seeing and hearing. All right. Is the child recognizing faces? So does the child know mommy? Does the child know daddy? As opposed to a stranger, many of them start screaming in horror because they don't see mommy or daddy. All right. Is the child making any sounds like they're trying to talk? All right. Is the child putting everything in his or her mouth? And that would be a 6-month-old assessment. All right. At 1 year old, is the child walking around? Is the child walking unassisted or still holding on? All right. Is the child pointing at stuff? So if they see something that interests them, is the child pointing at those stuff to get your attention, or does that, is it a child that goes and get it? Is it a get it, go getter type of child? All right. Is the child saying any words other than mama and dada? Because of course they would be saying mama and dada. Most of them start saying dada at first. Is the child saying dog, cat, other words? Is the child calling other person's name in the household, saying tea, saying juice, saying stuff? Is the child saying anything other than mama and dada? All right. And that is our 1 year old assessment. Is the child waving bye-bye? Does the child acknowledge when you're leaving? All right. Is it, if you're drinking from a cup, does the child drink from that cup also? So that entails our 1 year assessment. And as I said, the child will be vaccinated at the age appropriateness, and the child will also be assessed for the weight for the age. Is the child's weight for age normal? Is the child's height for age normal? Is the child overweight, underweight? Is the child obese? Is the child at a possible risk for overweight? All right, such the like. What is the size of the child's head normal? All right, is it smaller or bigger than expected or what it should be? Is the child still getting breast milk, formula fed, food from the family pot? What is going on with the child? All right, so these are some of the things. When we go to 1 year and 6 months, is the child climbing? All, if not most, if not all, 1 year and 6 month old children are climbing. They climb the grill, they climb. One lady told me the other day that she saw her child climbing the stove. Yes, they find everything to climb. All right. If you give them a book, will they turn the pages or will they tear it up? All right, and you know they're testing their motor skills at that time. Is the child pointing to the eyes, the nose, the mouth? Does the child know the body parts? All right. Is the child taking off his or her shoes or socks? Yes, trying to be independent. All right. And that is our 1 year and 6 month old assessment. Now we reach to 2 year old. Is the child kicking a ball? Is the child playful? All right. Is the child using copying vertical lines? If you give a pencil or a pen, a child just. So if you draw the line, does the child follow you and draw a line also? All right. If you give the child a book with some pictures in it, does the child recognize the pictures? Does the child recognize the ball, um, the girl, the cat, the fish, the kite, trees, apple, stuff like that? Does the child recognize pictures in the book? All right. Can the child tell me his or her name? 2 to 3 phrases, right? So while the child might not be talking very as profound as ours, does the child say phrases that you can understand? All right, enough to respond to them. Is the child obeying two-step commands? If you tell her to go to the bathroom, does she go to the bathroom? Does he go to the fridge? Does he go to the kitchen? Does he come inside when you say come inside? And that is what we do for our 2 year old assessment. For our 3 year olds, when you tell the child to jump, does he or she jump? Is the child writing? Right? Does the child know colors? When you put a piece of blue paper in front of the child, can the child tell you that is blue, or is he gonna say red or yellow? Does the child know colors as yet at age 3? Speech is intelligible to most strangers. So when the child talks, if I'm a stranger, will I be able to understand what your child is saying to me? Is the child undressing him or herself? So they take off their clothes and they come to you for help. Does the child do all these things at age 3? At age 4, does the child hop on one foot so they will elevate one leg and jump on the other? Can the child balance themselves on one leg enough to jump and return? Right? Is the child be able to draw a circle um, and cross? So if I give the child a piece of paper and a pen and say, draw a circle for me, will the child be able to do so at age 4? If you give him or her a scissors, will they be able to use it? Right? And funny enough, in all my assessments, when I ask this question, the parents say, yes, nurse, yes, nurse. And they show me where the child cut out a piece of their hair. I don't know if it's a trend with all children, but most children tend to clip a piece of their hair in their lifetime. So I don't know, once they grab a hold of scissors, I don't know, they just automatically head for the hair. All right, so that is always a laughter day when I assess my 4 year olds. Full sentence of at least 6 words. So at 4 years old, is this child giving me full sentences? Right? Interactive play, pretend playing. So I am over here and you hear the child over there playing mama and dada and teacher and students. That's what we call interactive pretend play. Fully potty trained, is the child still wearing a pamper at age 4, or is the child telling me he or she wants to go to the bathroom whenever they want to pass urine or to defecate? All right. At 5 years old, balance is on one foot. All right. Writes letters and numbers. So by the age 5 year old, the child should be able to write the letter 1, number 2, number 3, number 4. The letters A, B, C, such the like. If you draw a triangle or a square, will that child be able to recognize a triangle? Will that child be able to recognize a square and also copy them on the paper that you had done before? Is the child able to express his or her thoughts and feelings? Mommy, today I'm feeling sad. Or, mommy, I'm excited. My 2-year-old son comes to me sometimes. He said, mommy, I'm bored. And there are times when he comes and says, mommy, I'm so happy. And he kisses me and hugs me. And he is too. All right. So is he able to express emotions and feelings, how they feel? And this is very important, because if somebody should be doing them anything, they can tell you. All right, parents. So that is our, and feeds him or herself. All right. So that's about it for the one. So these babies are assessed from 6 weeks up to 5 years old. All right. And based on our assessment, these children are either considered normal, or we do our assessment observation. So we probably bring them in back in a 3 month time if it is a weight thing, 6 months time if we are referring them to a specialist to say, okay, I'm giving you 3 months or 6 months to return to me with information based on the referral that I made. All right. Also, there are some little things at once the child starts having teeth, they must be brushed with toothpaste and toothbrush. It is no longer a normal day when you start wiping it with a piece of cloth or rag, because remember, the children are eating food and therefore food will be lodged in between the teeth, and you need your toothpaste and toothbrush to actually dislodge some of those. Remember that at age 2, the child should start going to the dentist for their first cleaning, so they grow with the dentist and they're not so scared. So when they start at age 2, they grow with the dentist and they actually start asking you when it is time to go to the dentist. All right. Another thing to note too, the penis. The penis, you have up until about 1 year and 6 months, 2 years old, they're about for us to really get concerned to say, okay, it is not retracting, so the foreskin is not going back, so you can clean it as much. Some of them you can start small portions, so you just go back to where you can and you clean there, and eventually as they get a little older, and with assessment when they come to clinic, because we get to understand that some of the parents, they're a little scared in touching it, so it will be there, and once we try, it goes right back. So it could have gone back all along for them to clean it, but because they were so scared, they did not touch it. So you just try each time, go back a little, and you go back until you are not able to go, and you keep going back and you clean what you see until eventually about 1 year and 6 months, 2-year-old, when the child comes for assessment and we really see that. Remember, they're based on the assessment, and that's why I said every time you go to the clinic, a head to toe assessment is done for the child on the key areas, because we know at what age things should be happening or more than likely will be happening. All right. So if you are having a problem, parents, and I encourage you to make your jottings while you're at home with your children, so you have it in front of you when you go to assess the child at childhood clinic. You can ask the necessary questions instead of when you get back home. You don't, that's the time you're going to remember, when you really don't have another assessment for the child until 3 months or 6 months or a year time. Understand? And you might not have your healthcare provider's number. All right. Remember that exclusive breastfeeding is the way to go unless otherwise advised. And exclusive breastfeeding, I should say, is giving baby nothing but breast milk for the first 6 months of life, with the exception of medication. So baby shouldn't be getting any water, any juice, any gripe water, none of that stuff. You give the baby the breast once all the conditions are right. So those mothers who are having challenges and end up having to give formula or seeking other ways of feeding the child, I'm not talking about those persons. I'm talking about the persons where the breast is producing, the baby is latching on, the baby is sucking, and all is right. You start expressing your breast milk if it is that you have to return to work. All right, so and that will come up in another post where I'll teach you how to do your expression of your breast milk and storage for future feedings. All right. Also, some key things. So the nurse will ask, what is the child eating? Is the child having staples, foods from family animals, any other milk, peas and beans, vegetables, fruits. Parents, please remember that at 6 months old, the child is to start getting food from the family pot. So after you would have done your exclusive breastfeeding for the first 6 months of life, you would start giving food from the family pot. So basically, baby can get whatever you eat at 6 months old. All right? So when you're eating your food, the child should be right there partaking of it. You put to your mouth, you put to the baby's mouth, and you take your time and you incorporate the meals as best as possible. All right. Please ensure you have with you the baby's Panadol, Cetamol, whatever pain and fever you have for the baby. So once the vaccination process, you can follow up, as some vaccines might cause a little pain and discomfort, possible fever and such the like to the area of administration. All right, so that pretty much takes care of child health assessment. As I said, you can reach out to me if you have a concern. Bear in mind too that with the child health passport that each parent is given, remember you only receive one of this. Parents, it is your copy for the child, and this is the replacement for our immunization card that we normally get in the past. It has some nice little features here. Watching your child growing in the first page. So when the child is born, first week of life, you put a picture there. 6 weeks, 6 months, 1 year, 3 years, 6 years. So your child will see later on in the future how they looked at each developmental phase. All right. The child's name will be here, mommy's name, date of birth. Remember that here, page number 12, where they have sickle cell. You look out for that. Every child's book should have a tick there to state that the child was tested for sickle cell at birth. Now, the child's birth weight, length at birth, the head circumference at birth, time of birth is also in here. This page brings all the vaccination that the child will possibly get. So parents, you can look here to see what next your child will be getting. So we know that at birth, baby get BCG. At 6 weeks, we know that baby's gonna get such the like. And the different vaccines at the different ages. And so you can know, right? So we continue on. At each check, there are some questionnaires here. There are different ages where the parent or caregiver is asked to answer some yes and no questions. Parents, please, when answering these questions, if you come up at a question that you're not so comfortable with, please highlight it to your midwife or your pediatrician when you return. All right? The previous assessments that we would have been doing in the previous booklet that I was reading, the milestones that the children would have had, we will also document those in here. I must note too that at age 9 months, there is a questionnaire, that's page 24 and 25, where the parents are to do a screen here. This is a autism screen. All right. I know there have been concerns that the measles, mumps, and rubella vaccine is possibly causing autism in children. Now, if you're gonna do an autism screen at 9 months, when you would not have yet gotten the measles, mumps, and rubella vaccine until you're 1. That speaks volume as to tell you that it is not so. All right, so you would have already started, since autism is a developmental disorder in children, that most of them are genetically motivated. How can the vaccine cause autism in the children when the child was born with a developmental issue? And you would have done an autism screen at 9 months before the MMR is even introduced at 1 year old. All right, so I encourage you parents, do that 9 month screen before you go to the clinics or the doctor at your 1 year old visit before the child gets that measles, mumps, and rubella vaccine. Also at 18 months, the parents are asked to do another autism screen, page 30 and 31 in your baby's passport. Please, parents, you are supposed to do that before you go to your healthcare provider for clinic. All right. Also, there's another screen at 3 years old, and that's page 36 and 37. To the back of the book, parents, There are a lot of information, the weight of the child, meals that you can make for the child, and all the kind of information that you will need. The teeth, medical assessment, the different assessments that the child will need to do. Alright? So please, parents, become familiar with your child's passport. Alright? They even have a literacy thing around here. Right? It says the assessment will help you to understand the reading level of your child. All of that is in here, in appearance. Yes, all of that is in here. So this little booklet here, parents, please take care of it. Keep it in a safe and dry place. All right, and this is gonna be a lifelong document for your child. So I hope today's presentation would have been quite helpful, quite enlightening. Please go through, and as I said before, those basic assessments are what any child would be doing at those particular ages. All right, it doesn't mean that your child is any more or any less than anybody else. Please do not ridicule your child if the child is not doing same. All you need to do is just to enlighten them, encourage them, and continue to work with them. Parents, remember that you need to speak to your children, not only depending on the tablets, the phone, and the television. They need to have a verbal communication with the environment around them. Allow them to play with other children. I know it's now COVID, so that might not be possible. But whoever is in the house, do a lot of talking. Sometimes turn off the television and talk to the child. Have a parent and child reasoning. Talk to the children so they know what it is like to have a conversation with a real person. All right, other than having to talk to the tablets and the phones and the computers and the television. All right, so please, I thank you again for tuning here at Midwife Par Excellence. You know I'm here to serve the people of the country and the world in extension. And I want to thank you again for subscribing. And if you have not yet subscribed, please head on down, click the subscription button, and also click the notification button so we can all be aware when I do make a post. Don't forget to share with a friend, to tell a friend, to tell a friend, so everybody is channeled over here at Midwife Par Excellence. I thank you.